think I'm going to get started. We have a lot to go over today. Excuse me. First, want to say thank you for joining us. Hopefully everyone's got some coffee or tea or water. So we're here today to talk about the Consumer Engagement in Healthcare Survey or Study. And I've got two of my colleagues with me. We've got Greg Hershberger, who is a Managing Director of Healthcare and Benefits. And we've got Sara Rubinstein, who is a Director of Healthcare. And they're going to talk to us about the project today. Lots of interesting stuff to cover and go over. This is a trended, oh, can anyone hear me? Okay, good. Looks like Kendra, okay, Kendra's can't hear. I'm sorry, Kendra. We are recording this session, so if for some reason you're having some technical difficulties, we will have the recording available to share. And maybe the team can troubleshoot. Looks like she dropped off. Okay, super. Looks like everyone else can hear. So hopefully Kendra can get sorted and rejoin us. Quincy, I don't know if you want to go ahead and throw up the first slide, but I wanted to give a little background. Obviously, this is a trended study. And we have lots of data, but we're not going to go over the trend today. I'm getting, sorry. We're going to focus on some of the questions that are new this year, some of the hot topics. So I'll turn it over to Greg. Greg, you want to review the methodology and give thanks and shout out for some of our funders?
Sure, absolutely. So this was fielded in October through November. It's a survey of privately insured Americans. Again, this is our 18th year partnering with EBRI on this study. So it predates me by quite a while. I think I was in middle school the first time we did this. We weighted our results by gender, age, income, ethnicity, education, and region to be representative of the national population of privately insured individuals. And again, shout out to the funders this year: the Blue Cross Blue Shield Association, Health Equity, Millennium Trust, Siegel, TIAA, UMB, and Voya Financial. So thank you for funding this research. And to anyone on the call, if you're interested in funding the 2023 CEHCS, feel free to reach out to me, and we can talk about that.
Great. So just wanted to take a step back here because, we're kind of dealing with a strange environment on two fronts. We have a really strange economic backdrop that's going on right now with inflation and rising interest rates. We also have a really strange healthcare backdrop. We're coming out of COVID. We're seeing high demand for healthcare. Maybe some people put services off over time. So we had some natural questions this year that were new that arose around what's the landscape of healthcare costs? And so, Greg, if you could give us a little snapshot, like what are people dealing with? How are they, coping with that sort of health wealth connection?
These are Sara's slides, but I guess just to kind of set the scene, I mean, we have an inflationary environment. Interest rates are going through the roof. So, consumers have a lot to think about here. And obviously, one way to kind of save costs would be on healthcare, trying to lower your premium costs and move towards high deductible health plans. So we do have, a couple different subsets that we'll, walk through today. We have those traditional plans that are typically PPO, low deductible HMOs. That you'll see as one cut, and then high deductible health plans, which I believe this year are defined by individual deductibles of $1,400 and family deductibles of $2,800. So those are kind of the key cuts that we're going to be looking at as we go through these results.
Great, thanks, Greg. So I'll start us off. So the The previous slide was showing us just sort of general feelings of financial security. This is actually a trended question, but we didn't really see any trend differences this year. But as we can see here, pretty much most everybody is saying they're somewhat or very secure, but we do see a little bit of a difference in that very secure bucket, where more high deductible health plan members are saying that they feel very secure than the traditional plan members. And then so sort of keeping that in mind, in the next slide, new this year, we did ask if in the last year they saw their healthcare costs increase, decrease, stay the same. As you can see here with those two different bar colors, we are seeing some differences there. So the high deductible health plans, about half said that they saw their costs increase, while only a quarter of the traditional plan members said the same. Most of those were in that sort of stay the same bucket. So then we also asked those people who said that they saw their healthcare expenses increase, what happened because of that? What are the impacts? And so the top ones, sort of regardless of plan, seeing that they're saying that they reduce their discretionary spending, they decrease contributions to non-retirement savings, increasing credit card debt. We do see that 4 in 10 said they delayed going to the doctor or put off some visits and procedures. But the big thing that I sort of noticed here is that there are a couple of differences when it came to the traditional plan members and the high deductible health plan members, sort of in that green outlined box there, with 4 in 10 traditional plan members saying that they had difficulty paying non-basic bills, and they also decreased their contributions to retirement. So it's sort of an interesting thing, seeing how we're seeing some impacts to spending and financial stuff right now, but it's going to have some impacts later on because they're decreasing their contribution to their retirement savings. So something to keep in mind and to watch for in the future to see if this continues. And so we also wanted to sort of see what stress is like. And as you can see at that top, a lot of financial areas are coming out of top sources of stress. As Lisa mentioned, we're seeing a lot of inflation going on right now. So that is top regardless of plan type. Long-term finances, paying for everyday expenses, these are big areas of stress. And sort of outlined at the bottom there, big difference that we are seeing by plan type is more high deductible health plan members saying that paying for medical care is a top source of stress there. So we are seeing that sort of there is this tie-in with this financial stress and impacts to people's medical care.
Super interesting. I do want to mention sort of backdrop of this. Our high deductible plan owners do tend to be higher income, right? So you're talking about they might feel more secure, but they also are showing a little bit more stress about paying for those healthcare expenses, those medical expenses. So I think really interesting snapshot in this unique time that we're in. So one of the new sections we added this year was a look at open enrollment. We pushed the fielding of this survey to later in the year, right? October, November, traditional open enrollment time for many employers where you're choosing a plan for the next year. And consumers are facing this, unparalleled environment, essentially coming out of COVID and the inflationary sort of trends that are happening. So that really begs the question, like, what's happening with open enrollment? How are their plan choices changing? What really matters in terms of open enrollment? Do they feel supported? So I think if I'm correct now, Greg, you're going to take this section, right, and talk a little bit about what we saw in the survey.
Right. So we started off just by asking about satisfaction with various aspects of the enrollment process. And you'll see that these bars here are total, regardless of plan type. And the reason we're only showing total is because there really weren't any differences by plan type in satisfaction with these areas. So 60% extremely or very satisfied with the amount of time that they had to make a decision. And we'll get into that in the coming slides. Overall satisfaction with the enrollment process was also fairly high, only 6% saying they weren't satisfied. with the process. Folks are also happy with the materials that are being provided by their employer, and the amount of paperwork, or in this case, you would assume lack of amount of paperwork. Lower on the list here is satisfaction with who presented at open enrollment. So only less than 50% were extremely or very satisfied with who was there to walk them through the process. We can go to the next slide here. So thinking about how much time folks spend making that decision, it really varies. It can be anywhere from no time at all. This is, automatic re-enrollment, to more than 5 hours. Traditional plan members more likely to just automatically re-enroll than those high deductible plan members. High deductible members are looking at, at least 5 minutes, up to, 3 or 4 hours, or even more. Interestingly, overall satisfaction with enrollment, that number that we saw on the prior slide, it's about the same, regardless of the time it takes to make that decision. Although one thing I do want to call out, satisfaction is highest among those who are automatically re-enrolled or spent the most amount of time, so 5 or more hours. So there are a couple ways you can look at that. I mean, I think a lot of people go from 1 year to the next. They think I want to stay with my plan, so they automatically re-enroll. That's easy. They're going to be satisfied with their enrollment. At the other end of the spectrum, 5 or more hours, you think those people are really spending a lot of time trying to understand their plan. And if you spend that amount of time, researching, understanding, talking to folks, you may feel more secure and thus more satisfied. But those areas in the middle, the less than 5 minutes to 3 to 4 hours, satisfaction was about the same there. We didn't really see too many differences. And we asked what tools or resources were used to help make a decision. A lot of folks are using the annual employee benefits guide from their employer, an employer benefits online portal. And then there's some things that they do on their own, right? Like online research, and insurance, going to the insurance carrier or the provider website. Although one of the numbers from the slide earlier, satisfaction with tools provided and information given as they go through the enrollment process, that increases with the number of tools made available by the employer. So again, a couple of these things are things that folks can do on their own. They can research online, they can go to an insurance carrier website, but HR benefits department consultations, employee benefits online portal, and a benefits guide, as well as the educational videos, those have to be provided by the employer. And we found that satisfaction with tools increases with the number of tools that are available. Not necessarily seeing, one of those tools popping more than another as being a driver of satisfaction. But the more that's available to employees, the better. And then this, if you recall from the slide earlier, some of the lowest satisfaction was with who was available to answer your questions and who presented at open enrollment. The most common is someone from the employer, about 50% say someone presented, followed by a representative from the health insurance company, and then a broker or a benefits consultant. I think it's key that 1 in 7 reported having no one to ask questions to. And no one gave a presentation during the process. And interestingly, overall satisfaction is highest when an outside resource is coming in and presenting. So there's 62% satisfaction if someone from the employer presents, but that jumps to 67% if there's an insurance rep, insurance company rep, or a benefits consultant or a broker involved.
Really interesting. Thank you. I think there's lots to chew on there. I think what always strikes me is how little time people spend on their open enrollment. I think most people spend way more time planning their vacation than they do on their open enrollment. And obviously that has financial repercussions as they go through the year. So I want to pivot a little bit and cover our next topic that was the focus for 2022. And that was pre-deductible coverage. And we had the pleasure of supporting EBRI and VBID on an employer project to understand what employers are doing with regard to adding pre-deductible coverage, which is essentially, are we going to cover certain benefits before a deductible would kick in because they have sort of value in them? So think of things like insulin coverage for diabetics, perhaps some things for heart disease and et cetera. So we found that in that project, 3 out of 4 employers were adding coverage to their benefits as a result of these IRS rules that were around pre-deductible coverage. So we were naturally curious what workers themselves, those with high deductible plans, because that's really what this is targeted to, would say about pre-deductible coverage. So I'll turn it back over.
Sure. So we asked if among those with high deductible health plans, we asked if certain chronic conditions were covered on a pre-deductible basis. And we gave them a list basically of the new conditions that the IRS now recognizes as being allowed to be covered under a high deductible health plan. And only 37% said yes, they do have preventive care for that. But I think the biggest number here is that 38% said they're not sure. So there may be kind of a gap in education there as to, exactly what's covered before they have to pay anything out of pocket. Now, those who are aware of it, 45% say that having that pre-deductible coverage impacted their decision in choosing a high deductible health plan. So you would think that maybe if folks were better educated, you might see more of a shift towards high deductible health plans in theory. And then among those with traditional plans, we asked, all else being equal, how likely would you be to select a health plan with a high deductible if it covered preventive care for chronic conditions on a pre-deductible basis? Now, only 25% said they would be extremely very likely, but you combine that with the somewhat likely group, and again, we may be seeing a little bit of a knowledge gap with those who have a traditional plan. Might see a bit of a shift from traditional membership to high deductible plan membership. If it were more clear to folks that some, in a lot of instances, they're going to have this pre-deductible coverage. And then looking at specific coverage on a pre-deductible basis, we asked to what extent each service being covered before you reach your deductible would impact your likelihood to select that health plan. So these are kind of the most popular ones here: annual physicals, followed by cancer screenings, certain vaccinations, things like the flu or COVID-19, screenings for other diseases, and chiropractic care. And you'll see that for all of these, the high deductible plan members say that coverage of these are more likely to say that coverage of these would impact their likelihood to select that plan. So that's just telling me that they're choosing the right plan for them. So that makes sense to me. And then the last slide here is just a continuation of the same question. Some less, I'll say popular services, probably because they wouldn't necessarily apply to everyone. Things like smoking cessation programs or fertility treatment or weight loss services, a little bit less likely to increase the likelihood to select a high deductible health plan.
Great. Thank you, Greg. Thank you, Sarah. Wanted to pause to see if we had any questions or comments. from the group? Quincy, do you mind putting the presentation back up? There was one thing that popped in my head. I wanted to pick Greg's brain on a slide earlier. And I'm going to forget which slide it was, but I can get us there. I think it was somewhere in the middle section about the rising care, or sorry, open enrollment.
Yep.
Can you go back one more? Yeah, so the tools. I'm curious if we looked at, or if you know from the data, the time that people spend, does it go up if they have more tools available? You know, how do those two things interact? Because in my head, I'm thinking, you know, you're going through open enrollment, maybe you have less tools available to use, so you really just don't spend a lot of time on it. Is that something that employers can drive, right? Spending a little more time thinking about your plan by offering a lot more tools to the employee.
So yeah, you would assume that, and I think that's probably an accurate assumption. I haven't run the data, so I'm not completely sure, but you know, I can definitely dig into that and see what that looks like. But you would think that, I mean, among I think I'm seeing 4 on here, tools that can be provided by the employer, that the more tools offered, the longer folks would spend on benefits. But remember, we did see that the more tools offered, the more satisfied folks are with the enrollment process, whereas time spent, it wasn't really, you didn't really see kind of that positive correlation, you know, of spending more time on benefits, meaning benefit selection, meaning you're going to be more satisfied. So that may actually point to their
maybe not
being a correlation there.
Yeah, interesting. Any other questions or comments from the group? I wanted to make sure to mention, while we have you, this is just a tiny bit of data from this project, right? 18 years of history. The full trend is available on eBree's site. If you are interested in seeing sort of full trends in traditional and high deductible health plans, including sort of how those high deductible plans have grown over the years, with more and more people either choosing those or being placed into those types of plans. Just scanning to see if we have other questions. Quincy, anything coming through on your end? I'm not seeing any in the chat yet.
Not on my end.
Well, just want to thank you for joining us today. Appreciate you taking a few minutes out of your Friday, joining us for the coffee break, and hope you get a chance to look at that full report and the information that eBree is providing, and hopefully everyone has a great weekend.
Thanks, everybody.
Thanks, everyone.
Bye.